As we're discussing the cases you submitted, could you talk for us each of the cases that you submitted, because that would be very helpful for the audience who is listening and watching this.
Yeah, obviously I don't know, you can't listen back to the cases. The ones you submit, they sort of go from the platform, and I don't know, they don't give you a mark per case, it's all an average. But my mandatory ones, I had a 7-year-old with abdominal pain that I submitted as my paediatric case, because we discussed about stress at school, as well as, you know, mum really thought it was appendicitis, and it allowed us to sort of discuss the options and then bring in shared management with saying to mum if she felt okay, if we watched and wait, it was probably constipation, that sort of thing. I've mentioned my mental health case. It was a sleeping tablets request. My long-term condition actually is one of the ones, it was actually a mental health case as well. So I just put it for the long-term condition. It was someone with known long-standing depression that was now getting side effects from their SSRI. So we had to discuss changing her medication. And my over 65, I actually ended up submitting a gentleman who was having a flare of gout, and we were able to discuss prophylaxis as well. I found with the over 65, this was a category I was really, really struggling with getting within the time. And I actually found musculoskeletal and joint problems were quite a neat way of having something that really it really impacts anybody, but it could impact the elderly more if they can't get out and about at the moment with such delays for joint replacements and things. So I actually found that was quite good. And just talking back about doing things over and over, I think maybe focus on one joint of the body and get really slick at that. So then all the shoulder pains or something, you can then just keep doing that rather than doing a shoulder one day, back the other, knee, as in thinking of cases for the RCA. I found that helpful, but it's obviously up to everyone else. My acute case was hyperglycemic, patient that I actually admitted to hospital. And my women's health was one of my many HRT discussions, the one that I thought contained the most within the 12 minutes. And then my extra ones, again, I had a sort of women's health, I imagine. It was a breastfeeding lady with thrush for both her and the baby. And in this instance, she'd already on treatment, but the baby hadn't been treated. So there was a chance it was going back and forth. I've just said about the fibroid results. That was one of my extra cases. I had tired all the time. These are things that I was consulting with almost every day I was at the practice. So tired all the time, migraine, unintentional weight loss, and PR bleed, and a relative for an end-of-life care discussion. That's a bit of a haphazard way of my 13, but overall, it's really just the things that I was seeing once I'd got those mandatory criteria. It was really things I just felt more confident in, and those were the sort of cases that I ended up.
If you have been struggling with the RCA and have realized that doing it on your own might not be the best use of your time and resources, then book a call with me to see whether I can help you. If I can help you, then we can enroll you on the one-to-one coaching program. But if I can't, then at least you'll get some insights in your preparation. Click the link down in the description below to book a call. Take care, everybody. Bye-bye.